Hey, Remar nurses, it's the time of the week that we love around here. We call this Let's Talk NCLEX Monday Motivation. While there are classes canceled, live classes canceled all over the place, here at Remar Review, we get to keep it going. We get to keep our studying going. And so this is the perfect opportunity for you sitting at home, studying with the virtual trainer, want to take a break, whatever, to join me. Hey, my name is Regina MSN. I'm so happy to be your NCLEX instructor. Today's topic, we are getting into it with, of course, none other, infection control. That's right. We got 3 NCLEX style questions coming up for you today. If you are excited about this opportunity to study, go ahead, like the Remar Facebook page, smash that share button, subscribe to us on YouTube. I love having your company at these study sessions. Don't forget, on Monday, we also do Monday Motivation. Hey, the question of the day is what to do when the race is off. The race that we're preparing for, the race that we have been preparing for, has been called off. What do we do? The questions for you guys, let me just point you to the best resources. Of course, I am a registered nurse here to educate the future nurses, but the information is not intended for medical practice. So we're going to be talking about some infections and things like that. To learn more about the coronavirus, why don't you visit the CDC or the WHO for more information. But if you are ready to get started, here is your first NCLEX question coming right at you. Prepare your minds to study. Question number 1 says this: when using alcohol-based hand rub, the nurse should do which of the following? Is it number 1, apply hand rub when you see nursing management? 2, apply hand rub and wave hands until they are completely dry? 3, apply hand rub and rub palms together for 10 seconds? Or 4, cover all areas of the hands, including the front and back? What is the thing to do when you are using alcohol-based hand rub? Come on, new nurses. You're ready to take this board exam. We just got to keep on studying until our time draweth nigh. All right. So if you are excited about the answer, put it on the screen, smash that share button. I have the correct answer coming up for you here. It is going to be number 4, cover all areas of the hands, including the front and back. And remember, we're just trying to pick the best answer from the choices that we have been given. So number 1, if you're looking at it and you're trying to pick the best out of 4, number 1, apply hand rub when you see nursing management coming. Well, that could be a good thing, of course, but you should also use it at more frequent intervals as well. 2, apply hand rub and wave hands, it says, until they are completely dry. Well, no, the hands should not be waved around, so we shouldn't pick that one. 3, the time period is not appropriate. 10 seconds is not long enough. We should be rubbing our hands and palms together for approximately 20 seconds. So the one that we have to go with is number 4. Here's some more information on exactly how alcohol-based hand sanitizer should be used appropriately. And I got this from the CDC. And it essentially says, use an alcohol-based hand sanitizer that contains at least 60% alcohol. You got to be so careful when you're purchasing it or using it. Supervise young children when they use hand sanitizer to prevent swallowing alcohol, especially in schools and child care facilities. To apply it, put enough product on your hands to cover all surfaces, front, back, palms, in between fingers, all surfaces. Rub hands together until hands feel dry. This should take around 20 seconds. And again, do not rinse or wipe off the hand sanitizer before it's dry. It may not work as well against germs. So great information about something that we as nurses use very frequently. So this is a great question that NCLEX may ask us on the exam. All right, remember that 60%, that's super integral. Oh, one more thing, guys. We are still doing the flash sale, as it were. So check out remarnurse.com for the NCLEX virtual trainer. That is still going on. And if you love our questions, you're going to love the virtual trainer. Question number 2 coming at you. This is a wonderful one. Which of the following is true concerning the bacteria that causes tuberculosis? Number 1. You can inherit tuberculosis. 2, the common cold could cause a tuberculosis infection. 3, the best time to diagnose TB is after symptoms are present. Or 4, a negative Manox test rules out TB. Oh, this is good. This is good because we think we know tuberculosis. Tuberculosis is super common. Oh, we hear about it all the time. We know, oh, you hear tuberculosis, the first thing you think of is what? Oh, respiratory isolation, negative pressure rooms. But I'm not asking you that today. No, 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 no. I think people could get it down to 2 or 3. But really, do you know the fine details about tuberculosis? Do you have your answer? Is it number 1? You can inherit tuberculosis. 2, the common cold could cause a tuberculosis infection. Does that make you more at risk? What is it? What? 3, the best time to diagnose TB is after symptoms are present. Could it be that? Is it easier to diagnose? Do you have the symptoms? Is it better? 4, a negative Manox test rules out TB. Is that the truth? Is it more? Does it take more? What is it? Is it a chest X-ray? Is it the Manox test? I mean, how am I supposed to know? You know these things because you study. So let's reveal the right answer. All right, Remar, people, here we go. Oh, it's number 4. Hey, it's number 4. This is true. The Manox test is what is given initially to rule out tuberculosis. Yes, this is a very strong indicator of whether you have it or not. And so this is what we do to rule it out. We give this test, we give it in employee health, right? We give it to those vulnerable populations. And if it comes back negative, do we do any further testing? No, it rules out tuberculosis. So that one was true. Some people might have picked that it is best to diagnose TB after the symptoms are present. No, it is best to diagnose it as quickly as possible before the patient has symptoms so that they could be treated. That's why it's a screening that's done. Screenings are usually done. Screenings are done so that early intervention of medication can be given, right? So think about that. Think about that. The other 2 probably weren't as difficult to rule out. We know we cannot inherit tuberculosis, and the common cold cannot cause a tuberculosis infection. It is what's the word I'm looking for? You get it through a specific bacteria. That's the word I'm looking for. All right. Hey, let's do another question, shall we? This is getting good. All right, last question here. Here we go. Question number 3. Again, what is true concerning tuberculosis? Let's try it again. All right, number 1, tuberculosis only affects the lungs. 2, tuberculosis is a pulmonary disease. 3, tuberculosis affects the lungs and possibly other organs. Or 4, sunlight can be proven to kill the bacteria that causes tuberculosis. Oh my goodness, tricky, tricky, tricky. Tell me, what do you guys think the answer is? What is true? What is true? What is the truth about tuberculosis? Indeed, what describes this condition most appropriately? And it may It may not be what you think it is. And that's why I love when we come together and do these questions, because it just gives us an opportunity to demonstrate what we know, what indeed we know. Monday motivation, let's talk NCLEX. Here is the correct answer coming at you right now. It is going to be number 3. Number 3, absolutely. Number 3 is the right answer. TB, although we know that it can be considered a pulmonary disease, but tuberculosis is a little tricky bacteria. It actually can affect other organs. It can affect your skin, right? It can affect your lungs. It can affect your kidneys. The tuberculosis infection can do a great deal of damage to the human body. So it is not limited to just the lungs. It is not just a pulmonary disease. That is really putting it in a very small box that it can bust out of. All right, so hey, look, we know that we can spend some more time studying tuberculosis for sure. We can get to know more about it, and that's why we have this extra time to study, so that we can, just dig a little deeper into the content, because content is key when it comes to passing NCLEX. It's not about you doing 100 questions a day. It's not about you reading your Saunders book or your MedSurg book from cover to cover. No, it's about at the end of your study sessions, do you feel changed? Do you feel like you have learned something? Do you feel more knowledgeable about the clinical practice of nursing? And I hope you guys feel that way right now when you study with Remar. I got another topic for you guys. It is this: what to do when the race is off. What are these people here that we see? Are these just ordinary people? Are these just common people out for a daily stroll? No. And these are athletes, okay? And they're training for a very specific thing. And the title is What to Do When the Race is Off. And I thought about this as we were being delayed, because it was very much similar. Like when you are training for a marathon, or a race, you put in a lot of strategic time. You put in a lot of sessions to build yourself up to be able to endure a certain event. And you are doing this with the motivation that, number one, when the time comes, you will be ready. And then number two, there is a great reward for you at the other side of that event. And so for the runners, imagine everybody that's been training all year or since last year for the Boston Marathon. That is a huge race. People dedicate their entire existence to winning or being prepared for that race. And so just as we have been dedicating months and weeks and hours and minutes and seconds to preparing for this NCLEX exam, and then we get this notice that when the big race is supposed to happen for some of us, it no longer is happening. And it's heartbreaking. Can you imagine the day before your exam, you do the routine, you guys do my routine, you don't study the day before, you relax, you go to the testing site, you eat the right things, and you're planning for this big event the next day, and it's everything you've been working towards, and then you get to the exam center, and it's lights out, doors are closed, everything is locked up. You will not be taking NCLEX today. What do you do? What are we supposed to be doing? When I thought to myself, what are these athletes doing right now that cannot run? Are they going back to their normal diets? Are they going back to not training? Are they still continuing to train? What is the mindset? And so I thought this would be very applicable to us today, because what do you do when the race is off? Hey, the Boston Marathon coaches say that they're telling their athletes, number one, keep your goals as a priority, and then number two, work on your weaknesses. And I thought, oh my goodness, What great advice. I'm taking this advice and I'm giving it to the Remar nurses. Guess what we're doing right now? We're going to keep the goal of passing NCLEX as a priority, and we are going to work on your weaknesses, all right? And I am going to help you to take responsibility of these two goals, because I am going to be here making sure that you guys, day or night, do not forget your goal. It's your goal to pass NCLEX. It's not my goal. I passed it. I want it to be your lifelong mission right now. Like, number one, I got to pass NCLEX. You got to keep God first, and then we pass NCLEX. And so I'm going to be on here motivating you guys, studying with you guys, helping you to work on your weaknesses, because sometimes when you think you got more time to do something, the procrastination monster rises up, and you try to put it off, and you sleep on it, and you hit the snooze button on it. But we are going to be identifying those weaknesses. We're going to be exposing them so that when we take the test, we're stronger, we're determined, we're well trained. We're going to be doing the same thing that these Boston Marathon runners are doing. They're keeping their diet. We're going to be keeping our NCLEX diet consistent. We're going to be talking about medicine, talking about diseases, making sure that it remains a part of our daily routine, particularly to those of us who are testing very, very soon, March 25th to July 2020. I don't have an end date. They didn't give one, so they're leaving it very open. But if you are testing in the US or Canada, for RNs and PNs, this will be the fact, all right? And it is this: the computer adaptive testing will still be in place. So the NCLEX that you guys are open to take, but minimum number of questions that you will get now is 60. Whether you're a PN or an RN, remember for the RN, it used to be 75. That was the least amount of questions that you would get. That's the least amount of questions that you would get. Listen, share this video. Share this video if you are not aware of these changes, because if you are not aware, then that means somebody in your community is not aware. All right. So remember, you used to could only get 75 and you would find out if you passed, or 85 and you would find out if you passed. Now you're only going to get 60. The maximum number of questions, test items will be 100. Our time limit is previously, if you were RN, you would get 6 full hours to test. And then the PNs, you would actually get 5 hours to test. So you can see that time limit has been drastically reduced. It has been drastically reduced. Okay. Another thing to note is that even with these changes, the difficulty level will not change. The difficulty level of the exam, the passing standard, the difficulty level is going to be the same as it was before, whether you're a PN or RN, that will not change. And then the special research section, this was seen on the RN exams, that will no longer be seen. All right. And again, if you read the slide fully, guys. This is only for the US and Canada. Okay. This is only for the US and Canada. And again, these changes are for both RN and PN. We have been delayed, but we have not been denied. We know that we will come through this as a family, and we will continue to study together. Another thing, I will be coming to you guys from Facebook and YouTube, but I must direct you to the most important resource, better than even myself, better than the lives that I do. It is the virtual trainer. We have the questions there, the content, and most importantly, the accountability. Then all you need is the online review, and you need the VT workbook. So while I see everybody's prices going up, people are putting their prices up because they're not able to do the live classes, and they have to still pay all of their staff and faculty. Here at Remar, we're doing the opposite. We're dropping our prices, 90-day subscription, free shipping, drop that thing down to $149. I want you guys to have these books, and I want you to have this online review while we are studying. The test is getting The test is getting serious. All right. All right. Somebody said, yes, I got it. Perfect, perfect, perfect. RemarNurse.com is where you go. Also, check this out. I added a new book that I wrote. I hope you guys really like it. It's quick facts for nursing, specifically the pediatric overview. So I expanded on pediatrics. And if you guys know how quick facts works, then you know that the peds version of quick facts is fire. All right. So I put it in your file vaults. If you have the virtual trainer, mosey on over to your file vault and download that book to print out. You know, I really did not want to come out with another product for you guys to sell, guys, the book. I mean, there are just times when you just do things for the benefit of our community. And I never did a PDF book before. You guys know that I don't believe in PDF books. But I thought, you know what? My nurses need some incentives. They need to stay busy. Some of you guys are pushed back a month or 2 months and you can't really get to your exams right away. So this is a way to keep you guys studying. I also put so many new, and I didn't even put it on here, but I put a lot of new quizzes and I put case studies, and you guys have a ton of work to do. You have a ton of activities to keep you busy while you wait for these books. So if you order today, we are still shipping out. We do have our shipping department here. They're shipping books out. We had a lot of orders last night when I got on and told you guys about the changes. You guys hopped on. So while you're waiting, go ahead and get in the VT, get used to it, do the before the books arrive. We are still able to send these out today. We expect the post office to come and pick up all the orders. There's no delays. Also, international orders, we still are able to send those out. So if you have not, please, I'm just encouraging you guys, don't wait until tomorrow. Don't wait until the last minute. RemarNurse.com, because I really don't know the situation for tomorrow. I don't know what changes are going to happen. So thank you so much for everyone who is just encouraging people to study and things like that in the virtual trainer. So everybody that purchased on Friday, your products are going out today. Your products are going out today. You will see on the other side. It is very cool. It's a very cool resource. Okay. And yes, there's an RN and there's a PN as well. Okay. So guys, be safe out here. Things are changing rapidly. This is stranger than any movie I think we can watch, what's unfolding in front of us. And so Team Remar, we're working very hard. We're working extremely hard in order to get you guys through this difficult time. And we just want you to know, you got to keep God first. So let's be kind to each other. Let's continue to motivate each other as a community. All right. As a community. And so be safe out there. Email me, please. The website to connect with me is remarnurse.com, remarnurse.com. And as well, if you guys need anything in terms of account information, books, ordering, we are here today in the office. Support at remarreview.com so that we can help you get the products that you need.
Hi everyone, just stopping in to give you a quick review on my thoughts about the virtual trainer. As you could see in the back, I am now 100% complete with my virtual trainer, and I wanted to wait to do this when I was well into the process so that I could give you guys my real opinion. As you could also see in the back, I also had the DVD self-study guide so I can do a little comparison as far as that is concerned. I've been wanting to do this review for a while now, and a lot has come up. I'm sure you could tell by my voice that I'm not feeling 100%, but I just needed to do this and get it out of the way. So let me just say that I love the virtual trainer. A few things that I noticed that are different between the virtual trainer and the self-study guide is that Regina took the time to expand on a lot of the content. For example, she expanded the content on pregnancy, the developmental milestones, and such. So I really liked that there was more information and a little bit more clarification on that as well. Also, Regina redid the videos and she made it more attractive and appealing to the senses. She added some color to the background and she added some background music, some videos, and some picture illustrations. I think that made the videos really good. And I'm looking at my notes every now and then because I made a few notes so I don't forget a point. She also included more question and answers within the lecture as opposed to the DVD self-study. She just went straight through with the lectures, but within the lecture now she would do some questions with you, which is also good. I think that because the virtual trainer, and that's another point, also has an expiration date, it kind of keeps you in check. It makes you more accountable. You know, you want to finish that content before your expiry date comes up, so you keep at it until you are finished. It makes you want to keep studying too. It's really interesting, and every time I get a break, the first thing I think about is the virtual trainer. It's fun. It's fun for me. It's more specifically detailed on the calendar. She gave a calendar, and in the calendar, I printed mine out from the file vault. In the calendar, she presented it like a checklist and she gave time. So I didn't exactly stick to the times, but I used it as a guide. So at whatever time I started, her start time is 8 a.m., but sometimes I started at 5 p.m. I just follow the times through, making sure I use about the same amount of time to ensure that I manage my time appropriately. So that was another wonderful thing that came with the virtual trainer. Also, it allows you to communicate with others as well. So you have a question, you can get right into the virtual trainer and get some help from your colleagues. Unlike with the self-study DVD, it was just you and those books. Yeah, so generally I really like the virtual trainer, and I can't say that after you have done with the 6-week self-study guide that you are ready to take the exam, because I've never taken the exam before. But I'm sure if you look at some other videos and testimonials, you could hear others vouching for the fact that they were ready and they succeeded after following the 6-week program. Since I am 100% complete with my virtual trainer and I still have time, I think that's so wonderful because it gives me the opportunity to go back and look at, I'm going to go through the entire 6-week calendar again at a bit of an accelerated rate because it would basically be like a review. So I'm using this opportunity to review the information and to make sure it's solidified. I do like the fact that I get rationales every time I finish learning the information on the content and I take the quiz. I like the fact that the rationales are provided. I do wish that I could have gone through the rationales even after the quiz. Like, I wish that once I had taken a quiz, there was a way that I could go and review the rationales without having to do the quiz again. That would have been super. But I love the virtual trainer as it is, and it comes with the quick facts and everything. I think it's excellent. I do believe that if you have only the self-study package, it would be effective. But I think that the virtual trainer has an edge over the self-study package. So if you can get that, you get it in. Sorry for my voice. I'm not 100%, but I just needed to do this video.
As always, it is a sincere pleasure to be the #1 NCLEX instructor on this planet. You guys, this teacher and a friend during this time. I always like to leave with this thought, which is, I can, I will, and I must pass NCLEX.